Welcome, everyone, to the La+Jolla+Cosmetic podcast. I'm your hostess, Monique Ramsey. And today on the podcast, my guest is Nicole. She's our director of nursing here at the center. But today she's actually going to be talking about her experience having surgery with La+Jolla+Cosmetic and Dr. Brahme. So welcome, Nicole. How are you doing?
Good. Thank you for having me.
Yeah, thanks for coming. So tell me a little bit about, how long have you been thinking about a mommy makeover and, what made you finally this is the time?
Oh, gosh. So probably I've been thinking about it for over 18 years. I have my oldest child and she is getting ready to turn 18. And I probably thought about it since I was pregnant with her.
Oh my gosh.
Right. I went from having a normal feminine body to being a huge blimp, I felt like. And I just knew that it was inevitable that I was going to have to do this one day.
So you have an 18-year-old, and then do you have any other children?
I do. I have a 16-year-old, a 6-year-old, and a 3-year-old.
Oh my goodness.
So 4.
4.
Yes.
You're brave.
And busy. Yes.
And busy. And you look so young. So I'm not sure what you're doing there, but it's working.
Well, I work at this fabulous place called La+Jolla+Cosmetic. So
exactly. It doesn't hurt. That's right.
It doesn't hurt.
So 4 kids. Oh my gosh, that's a lot. So for people who are kind of maybe thinking about, what is a mommy makeover? How would you best describe how you went about deciding, what procedures to include?
Right. Like you said, a mommy makeover can include so many different procedures, and every woman's idea, I think, is different as to what they want their body to be back to. So when it came to my decision, one of the biggest things that ends up being left over from having children is loose skin in the abdomen and, stretch marks, and wearing a bikini after that is kind of non-existent for some women. Other women are pretty lucky, but I wasn't one of those lucky women. And then, the hardest places to lose weight are your flanks and the back. So like the lower back fat, if you will. So, I've really worked hard about trying to lose it and exercise and healthy diet. And it was just, nothing was helping. So that was definitely on my priority list, was getting rid of that extra skin and, the back fat mass, if you will.
Mm-hmm.
And then, so with that, they did the extended tummy tuck. So the incision actually goes around to the back along with some liposuction to kind of bring down the volume to give me a nice waist, which is what I was looking for. And of course, Dr. Brahme nailed it. And then the breasts are the other thing that you notice with moms. They've breastfed, especially after breastfeeding 4 kids. They were kind of just sad. They were not perky and happy anymore.
They were all used up.
Exactly. So the breasts were my other area of concern. And so I wanted them lifted up to look more youthful and have a better shape. And then I asked him to put in a small implant just to give me some volume in the top. That way I didn't have just the top sloped breasts. They were nice and lifted, and now I have the nice volume in the top, and they look phenomenal. And then the other thing was that to accentuate the waist, in the liposuction, I didn't want to waste the fat. Of course, it's good fat. Why waste it? So exactly. I asked him to put it in my buttocks so that I could have a little bit of extra curvature there. And it really just came out a really great hourglass shape.
Oh, that's so nice. I mean, especially I feel like, moms have earned the right to try to recapture their body from prior to kids. I don't think any of us would change our minds about having kids, even if it does kind of wreck your body.
Exactly.
But it's nice to know that there are some procedures, depending on what you need, that can get you sort of restored and back to yourself. And I think you deserve it. And I'm glad that, Dr. Brahme was able to, get you back to what you want. Now, let me ask you, when was your surgery?
So it was on the 10th of March. So I'm a month out now.
It's a month. Wow.
Yes.
Wow. Like I
Yes.
would have thought maybe like 6 months. I mean, you look great. Like, how are you feeling? You feeling good?
I am feeling fantastic. I actually came back to work after a week, kind of limited duty. Well, pretty limited duty. And I did short days, and it was like, I knew that it was going to be difficult, and I thought it was going to be a lot more difficult, but I was actually surprised, and kind of surprised my peers as well, that I was actually able to come back to work after a week.
Yeah, that's pretty short.
Yeah.
I know I wasn't in that space after my mommy makeover.
Most people aren't, and that's completely fine.
Yeah.
Everybody heals differently, and
Yeah.
you know, it just really depends on pain tolerance and how you heal and your
and
body.
Not overdoing it. I think it was smart if you're, not running around the office, you're sitting down and you're
Very
doing
limited.
shorter days. And that makes it. And plus you have the doctors right there to help you.
Exactly.
If you need it.
And of course all the nurses are trying to pitch in and make sure I'm not overdoing it.
Right.
And, everybody's like, oh, do you need to sit down here? Let me get you a chair. So it was very accommodating. It was nice.
Now, as director of nursing, in terms of what you do in the center and who you interact with, are you mostly in the clinic or in the operating room, or a little bit of both?
So I kind of interact with everyone. So I have to make sure that the surgery schedule works out for the doctors, the nurses, the scrub techs, the anesthesiologists, kind of putting it all together as a big puzzle. So I work in the clinic as well with Dr. Swiston primarily right now, just a couple of days a week. And I basically manage all of the nurses and nursing staff. That would be all the medical staff, all of their schedules. I help with the coordinators with coordinating surgeries and adding them on to help patients get their optimal surgery time, because we know that getting that date is the biggest thing for a lot of patients, and making it work for them in their life is huge. So I work very closely with the coordinators as well to try to make those things happen for people.
So you know all the secrets of the clinic, and you know all the secrets of the OR. So was there anything at all surprising, I guess, being a patient? Because you've seen it all from the employee point of view, but then sort of going through the process, was there anything that kind of surprised you or that you weren't expecting?
Yes. So I, working in the environment and doing or being hands-on, I guess, with the patients before, during, after surgery, you would think that for me to have surgery would be pretty simple, but I actually was very surprised about how squeamish I was to my own recovery. So I was actually very squeamish. It was almost embarrassing at that point.
Okay, we'll get into that in a minute. So I want to get thinking about bringing yourself back to, let's say, 5 weeks ago when your surgery was still coming up. Was there anything that you were worried about or concerned about, or that you wanted to make sure was addressed, like at that pre-op appointment or during your consultation with Dr. Brahme? Like, how did you all work together, and what did that look like?
Well, knowing as much as I know, trying to choose the implants that I wanted and the sizes and all of that, I thought, oh, well, I know Dr. Brahme, he'll do a great job no matter what, he'll get me on the table and he'll choose all of this. But then I was like, wait a minute, but what about if this, like, what about if I get this implant and I decided, and that's not really what I wanted. And, the kind of going back and forth with everything. I actually talked to him multiple times about sizing and shape and all of that. But really feeling like I was heard, and that everybody was, pitching in with their opinion about what I should kind of shoot for or not shoot for, if, I chose this type of implant or that type of implant. And just finding out after surgery, he like absolutely listened to me and nailed it. I mean, that was fantastic.
So did you do the sort of the implant sizing or try on some different sizes or shapes or profiles? I know some of them are more round and some are more high profile and teardrop and all these. And then we also have the Vectra imaging system that for 3D. So what tools helped you get to that size that you were trying to aim for?
I think the biggest thing was trying the implant sizers with the bra and actually seeing what it would look like on my body was huge. I thought I wanted, a 350cc implant. And when I put that on, I looked like, Dolly Parton. they were just way too big. And so, Dr. Brahme's like, no, I think this is my thought, probably between a 200 and a 300cc implant. And so I tried those on, and sure enough, like I found a good size range, and, he was like, yeah, we'll try them and see what looks better. And then that's what we did.
That's good. That's good. Yeah, I would think, having a variety of tools to help you, because some people might find that 3D imaging and seeing that is more helpful. Other people would be like, yeah, I need to see it on me, and look in the mirror and have other people look. So you ended up with what size at the end?
I did 230.
Oh, 230. Okay.
Yep.
And see,
and the high profile.
Oh, and a high profile. Oh, that's nice. So that kind of gave you that cleavage that you were looking
the
for?
The upper pole fullness. Yeah.
Nice. Exactly. Nice. Now, let's go into maybe the day of surgery. What was that like for you? And especially because you've been, again, on that other side as a nurse, and you know what's going to happen because you've been there. So it's not like a scary thing, like, I have no idea what's going to happen to me.
Right.
You're prepped from your pre-op, and then you're prepped from also because you work here. But that morning, what was that like for you?
I kind of got brought in by my husband, went into the check-in room, got changed. It was kind of surreal because I was like, I'm so used to being on the other end. And I was actually trying to help a lot with getting myself ready. And everybody was telling me, okay, just sit down. Like, you're, like, we're going to do this. You're the patient today. So, I was surprisingly a little bit nervous. I don't know why, because I've had surgery multiple times, not cosmetic, but other. And I didn't think that I was going to be really that nervous, but I was a little bit nervous. And of course, Dr. Brahme came in, talked to me, did the markings, reassured me that everything, was going to come out and it was going to look great. And I got to talk to anesthesia, and Dr. Saltz was my anesthesiologist, and he did a fantastic job. I woke up and I was in minimal pain, had no nausea. I mean, it was fantastic.
Oh, that's nice. So, let's say you have your surgery, you're in recovery. They're like, okay, it's time to go home. Did you go home, or did you go to aftercare? What was that like?
I went to one of the hotels here close by that we use a lot. I did have aftercare, even though I am the director of nursing for this, facility. I just, I knew that my husband would know kind of what to do, but he wouldn't really necessarily know how to help me or what might be normal or what might be abnormal. So I did choose to have aftercare. So the aftercare provider, she was absolutely fantastic. She helped me throughout the entire night. My husband got to just sleep. So he didn't even have to, he would wake up for a minute and see she had me. He's like, oh, she's fine. So yeah, it was great. I, from that experience, have encouraged women that are having a tummy tuck, especially, to have aftercare, whether their criteria requires it or not, because we do have some criteria that requires aftercare, but I've been definitely encouraging it more.
And so was that for one night or 2 nights?
I had it for one night, and then Dr. Brahme actually came to the hotel the next morning to check on me and make sure everything was okay. And then I got to go home from there.
Oh, that's good.
Yeah.
And I would think, I don't know, I feel like knowing, it's just that extra sense of security of having somebody who's medically trained looking
Right.
over you in the rare case something would be needed. It's
Right.
I would, and that you're not putting your spouse or your, anybody who's taking care of you in a weird position where they're really stressed out on
Exactly.
what should I
And
be doing or how do I help you?
yeah, I can't imagine that he would really know how to help me. He actually was very vigilant about what the aftercare provider was doing so that he could help me better when she was gone. So that was it was huge for me. Like I said, I still tell people now, I'm like, you're having an abdominoplasty or a tummy tuck, you should definitely have aftercare. It's just makes life so much easier.
Yeah. Now, did you find, as far as for pain medication, because they're cutting into you in a pretty significant way, for pain medication, did you find you needed, I mean, I'm assuming the answer is yeah, you needed them, but like what does that look like for people who maybe want to know, like, what's my pain control like and kind of how long will I need to have it?
So we have multiple modalities for pain management. We utilize Celebrex, which is an anti-inflammatory. We use Tylenol. Some of the physicians will use ibuprofen, which is also an anti-inflammatory. And you can have those 4 times a day at maximum doses on top of the narcotic pain medication that we prescribe. And also gabapentin, which is for neuropathic pain, which helps tremendously for post-op like liposuction or any kind of incisional burning or stinging that you might experience. I utilize the Tylenol, the Celebrex, and the gabapentin primarily, and I just took that 4 times a day, kind of on a schedule for the first couple of days. And then I would use the narcotic pain medication for breakthrough pain, and maybe a couple of times a day with that for the first, I don't know, probably 4 to 5 days. And then after that, I just needed it kind of at night to help me sleep a little bit better.
So let's talk about the scars that you have and what you think about them and if it was worth it.
I would say the scars are 100% worth it. The number one thing that I always try to point out to patients when they are really concerned about the scarring is you are only going to show the scars voluntarily. They are in places that are completely hidden by clothes, typically even a bikini. You're not going to see them. Dr. Brahme and all of the surgeons that work with us, they all make sure that the scars are nice and low in the bikini line, top and bottom for the abdomen and the breasts. You're the only one that's going to see your scars or your significant other. And in clothes, you're going to look fantastic. And I mean, the scars eventually they fade. So yeah, they are bright and kind of ready and, raised a little bit at first, but those scars fade just as well as any scar that you got when you were a kid that you could barely even see or don't even see anymore. So
yeah. So 100% worth it.
Absolutely.
Yeah. I think, for people who I remember when I was, kind of backing up for being a patient coordinator, if we had somebody on vacation and I would quote patients. And I remember a few times women were like, yeah, they wanted like their breasts restored to where they were, but they didn't want the scars. And it's like, well, you can't get there. Right. You can't get there unless you have the scars to be able, I mean, it's gravity and physics and stuff that, but it's worth it. And I think when people just think, oh, I have enough skin, you could just put an implant in there. Well, no, because then it's just going to be hanging.
Right. And, gravity does happen.
Gravity happens. Yeah. So you have to be able to support it. And so, but you're right. They do fade and you don't even think about it. And it's a lot easier to, hide the scars because you're like you say, you're wearing clothes anyway, then have like an extra bulge of fat around your middle. You're like, I can't zip my jeans up. So having that skin gone, it's like, okay, now everything zips and is perfect. So
yeah, I mean, I was wearing a form-fitted dress and I couldn't hide the skin that was there. No matter how tight of a garment I put on to try to suck it in and hide it, there, it was just not going anywhere. And if it did go somewhere, it came out the other side. So
I've been there.
And now I don't even have to think twice, it's just, it's gone. And I have a few scars, but I would rather have the scars to cover up with my clothes than try to hide all my extra skin and fat.
Yeah. The bulges are not fun. Shapewear is great, but shapewear can't do everything. So now you said that the fat transfer, like they're taking some fat out from some places, like to get a more defined waist around your hips, and then having that transferred into your buttocks. So do you know how much fat was transferred?
Yeah. So it was about 12 to 1300 milliliters. So that's, a little over a liter. There was a little bit more on my left side because I had a little bit more of a flat indentation there, just from aging and muscle atrophy. It happens to everyone. You get those little side hip dips, and I had more of a prominent one on my left side. So he put a little bit more there to just round that out, and then filled in the other side with the rest of it.
Perfect. That's nice. And did that cause any difference, I guess, in how you healed, or what your healing plan was? That I'm wondering if your tummy's been cut into and you've got, scars that wrap around your waist, and then you also have fat that's been put into your buttocks. It's like there's no safe space. Like where do you go to get did it feel like more numb, or did it feel like you had pain in certain areas? And how did you stay comfortable?
That was the biggest challenge. So trying to figure out how to lay in the bed was a conundrum. So luckily I have an adjustable base bed. So my bed lifts up and down. So, that I found extremely helpful. But, if I didn't have that, I would say I would probably just prop myself up on a ton of pillows. But I had my BBL pillow under my thighs, like the base of my buttocks. And then I had pillows that kind of went under my back and my head elevated with my bed so that my butt would kind of float in the air, I guess, while I was laying down.
You made yourself a donut somehow.
Exactly. That's essentially what I did.
A pillow fort.
A pillow donut. Yeah. So my butt could kind of suspend in the air, and then I would lay on my back, and I'm not a back sleeper at all. I'm a side sleeper. So that was an adjustment. But once I got through, the first week or so, I started trying to slowly turn myself on my sides and figure out how I can, make myself more comfortable on my sides. And at first it was kind of not working out, but after a while of continuing to try to do it, it just worked itself out. Probably a couple of weeks, I was able to sleep on my side again comfortably.
Well, that's good. That's good. Yeah. I think body position is kind of a tough one. And it'll be nice that, as now you've gone through it, you can help other patients and go, try this or try this, or don't try that.
Yeah.
The adjustable bed is like a game changer for life in general, I have to say. That's really what I did when I moved and I got a new bed. My mom said, you got to get the adjustable base because it really, if you're not feeling well or whatever, you can elevate yourself and feel better. So that's good for surgery. So if the goal of a mommy makeover is to really kind of, feel confident and reclaim your body like you were pre-baby, even though you're still healing, it's only been a month, but do you feel like your surgery has been successful in kind of helping restore that for you?
Oh, it's better than I could have ever imagined. I actually have never had a body that looks like I have now. It's better than pre-baby.
Oh,
for sure. So, it was I knew that it would come out good, but I did not know that it would come out great, more than I could have ever asked for.
Wow. Oh, that's huge. That's
huge.
So let's go back to my question earlier where you alluded to getting kind of what did you say about kind of what surprised you after surgery?
I got a little squeamish.
Squeamish. That was the word afterwards. Yeah. So what was that like? What were the things that sort of were a challenge for you that you weren't expecting after surgery?
Definitely the drains. I've never had drains before. And with the extended tummy tuck, you end up with 4, drains. They're JP drains. And essentially what they do is they create a negative suction so that you can suck out any extra fluid that your body naturally produces to kind of help with healing. But if you don't get that fluid out of there, then it accumulates under your skin and it becomes very uncomfortable and you're swollen even more so. Those drains really help mitigate that. I went in to have my drains removed and I immediately just got really hot and flushed and sweaty.
Oh no.
And I never even expected it. I was like, oh, it's easy. It's a drain pull. It's no big deal. Because, essentially all they have to do is snip a suture and it comes out just super easy. Like it just pulls right out. And I've pulled them out a million times out of other people. And I'm like, oh my gosh, what is wrong with me? Here I am getting sweaty. And I told the nurse that was helping me, I was like, oh my gosh, I'm so sorry. And she's like, no, it's okay. It's okay. But yeah, quite embarrassing.
Maybe because you knew what was coming.
I guess. I'm not really sure, but it does happen with other women. And I never thought it would happen to me.
Yeah.
But
yeah.
Here I am.
Here you are. And that takes like what? 10 seconds, 20 seconds?
A few seconds. It's very quick.
Very quick. So what would you tell somebody who's thinking about having really any, whether it's a mommy makeover or any kind of plastic surgery? What advice would you give them?
I would advise, having consultations with multiple physicians just to know who you're comfortable with, because the more comfortable you are with a plastic surgeon, the better outcome you're going to have. If you go into surgery feeling like, yes, this is great, I have 100% confidence in this person, then of course your healing time is going to, be much better than if you go into surgery and you're like, oh my gosh, I'm not sure if this is the right thing to do. What am I doing? I think the biggest thing is being confident and going into surgery knowing that it's going to turn out fantastic, having that positive attitude, because it really does play into your recovery. Mm-hmm. The other thing would be to make sure you have backup plans. So if you do have your surgery scheduled and then something happens on either end, your schedule, something happens, you get sick, or a family member who's supposed to take care of you ends up sick, then you have somebody to help either during that time that your family member's sick, or a secondary plan for another surgery date, just in case anything happens, because, we plan our lives around these events and, unforeseen things do happen. So that would be my biggest advice.
Now, Dr. Brahme, he's kind of like the master of all the things. Yes. He's really good at everything he does. And he does a lot of mommy makeover surgery. So what was the thing that made, you have 6 wonderful surgeons to choose from, 5 of whom do body procedures. How did you select Dr. Brahme?
Honestly, I see his work all the time, and he does so many mommy makeovers, and he's just got it down to a science, and his eyes for perfection are just amazing. You can tell him what you want. And like I said before, I was heard. I told him what I wanted and he delivered 100%, actually more than what I could have imagined. And I just knew that he was the one. I mean, he does so many and they all turn out so well, and people come back the day after surgery and they're in tears of joy, not even in tears of pain, because of, how he performs.
Yeah. And, and I think you alluded to something at the beginning, which is sort of that feeling comfortable with your team, not just with your decision, because you have to feel comfortable about your decision to do something, whether you're going to do it or not, where you're going to do it, where you feel safe. But then also feeling comfortable just person to person, like in a human way with that surgeon, with that nursing team. And some people, want something that, a person like Dr. Brahme is really fun and outgoing and, very serious about his work, but has a more effervescent sort of personality. Other doctors, might be more reserved. And so, and there's no right or wrong answer for how you feel when you experience. And I think, so your advice about, meeting with more than one surgeon, if it's at La Jolla Cosmetic, if it's outside of La Jolla Cosmetic, to get that comfort level, because it is a partnership as you go through.
Oh, and, huge partnership.
Yeah. So I think I like that you kind of, felt that not just, I know he's good at what he does and he does a lot of it and I see the good results, but that I'm feeling comfortable with our partnership going into this.
Absolutely. Dr. Brahme is so personable. And, like I said, it's like when you're talking to him, you're telling him what you want. And it's almost like he sees it as you're describing it. And, he can deliver.
So what would be anybody who's listening, you probably all have questions for Nicole, but we'll answer them if you, post on social media or on YouTube if you have any questions. But, if you were going to give advice to someone who's thinking about a mommy makeover or any surgery, what should they look for in a plastic surgeon?
The number one thing to look for is that they're board certified. All of our plastic surgeons here at La Jolla+Cosmetic are board certified. We also have board certified anesthesiologists. We don't utilize nurse anesthetists. We have a certified surgery center. Those are all really key elements into having a successful surgery experience, I believe, for plastic surgery, especially because there are, unfortunately, some other places out there that they don't hold the high standards that we do here at La Jolla+Cosmetic. The board certified plastic surgeon, number one, is the one thing to definitely look out for.
Yeah. And actually, you bringing this up, it's very interesting. Just yesterday, there's a story in the news, and the story's been in the news because it happened 4 or 5 years ago. But a patient had surgery with a doctor here in San Diego, and she was having a breast augmentation, but there was no board certified anesthesiologist there. There was no accreditation for his facility, and based on what I've read. And, she passed away, and nobody should be giving their life up, for surgery. And, so I think we need to do an episode on it for, really diving into what some of these certifications and accreditations mean. And, what you bring up is really important, that, having a board certified anesthesiologist who solely dedicated to your care, that's a little more expensive than having the doctor doing it under local or something,
or even have a nurse administer,
or a nurse administering it,
or anything like that.
So, or having surgery not in something that's accredited at a high level, and all these little shortcuts. And that's kind of what the article I was reading was alluding to, the shortcuts that this surgeon was taking, that, in their lawsuit that they're having, there's now a murder charge. And so that was kind of the new thing that came up. And so being educated, I think, your point about, making sure that it's a board certified plastic surgeon, that, who's doing your anesthesia, what kind of facility is it in? Those things they're not silly to think, everybody's probably good and everybody's probably, or they wouldn't be able to do it, right? Well, there are a lot of laws on the books, but, things happen. And so,
and there's loopholes everywhere.
Exactly. Exactly. And so, doing your homework ahead of time, I think, is a really critical factor.
Absolutely.
We
100%,
have,
because you don't want to be that person. I mean,
yeah,
it's absolutely tragic to go in for something that seems pretty benign. It's essentially a skin surgery, and you come out on the other side
yeah,
not waking up.
right,
So,
right. Two kids have no mom. And, it's just, and I think, we don't always question the things we should, so I think it's good to do your homework. And we have a lot of information both on our podcasts. We have an episode with Dr. Steve Saltz, one of our anesthesiologists, and he goes into what you should be looking for and kind of some of the most common concerns about anesthesia. So we'll put a link to that in our show notes. We also have a page on our website that explains board certification, accreditation of your facility, and has links to you so you can check and see that the doctor that you've chosen or that you're thinking about has the right certifications and that you're in the safest hands. And I think that's, all of us want to look great and feel great in our bodies, but also like how we get there is, and a really, really important thing. And I'm glad you brought that up.
absolutely.
So let's see. Is there anything we haven't covered? Is anything like in that this first month after surgery that you want to cover that maybe we haven't?
Well, I can maybe speak a little bit to resuming normal activity.
Oh, yeah.
So, like I said, I'm only 4 weeks out. You're not released back to full activity until 6 to 8 weeks after a tummy tuck. So that is one of the things to consider if you're going to have a tummy tuck specifically, or probably any type of plastic surgery. You're going to want to give yourself 6 to 8 weeks to fully recover. And just know that that's including your workouts and gym time. Well, that's a big question that comes up almost right after surgery. Patients are like, oh, when can I go back to the gym? And I'm like, that's going to take a little bit.
Yeah, you don't want to set yourself backwards in your healing, and because then it's hard to get back to where you were if you overdo it. But also, you were mentioning the ages of your kids, and your youngest is 6.
My youngest is 3.
Oh, 3. Oh, sorry. Yes. 3. Okay. But so what have you been having to do with your 3-year-old or not do during this time?
It's really kind of a funny story. So I came home after the night at the hotel. I went home and, I had to explain to my littler ones, my 3 and 6-year-old, mommy has owies. I had surgery at work, and, it's going to take a little while to recover. So you have to be gentle. And my 3-year-old Beckham, he would accidentally, elbow me in one of my breasts or whatever. And then he would turn around and go, it's okay. It's okay. And he would, I'll make you better. So I really had to just prepare him that, mommy had owies. And then when it came to seeing the drains, those are kind of scary for a little kid, And so we made a game out of them. So the drains, they put out like a little bit of bloody drainage, and he sees these and he's like, what are you, Frankenstein? I can just imagine that's what he's thinking. So we made this little game, and he got to shake my drains like they were like instruments, like maracas or something. Oh. And he would call them my blood bags. Oh. After I got them out, he was like, I came home and he goes, Mommy, I want to play with your blood bags. Where'd they go?
That's funny. Yeah, I enlisted my daughter. I don't remember how old she was. But I enlisted her in my drain care. She was very, she was fully into it. And, like marking how much output, you have to keep a little chart. And so she would come in and she'd be very studious. It was
my 6-year-old did that for me too. He thought it was cool. I was like, okay, write this number here, write that number there.
Yeah, exactly. So it was, I think it's all in how as long as they know you're not really hurting or
Right.
that it's like, it's okay. These are things that are okay. And
and kind of, no, I can't carry you right now. Remember, mommy has some owies. They're getting better. And so, they kind of didn't like it sometimes, especially my 3-year-old. He was like, but I need you. But we got through it.
Yeah. So, let's see. So are you back up right now to like full, you're in a month, so full working, and are you finding that you're more tired at the end of the day or anything kind of like lingering from the recovery that you're having to sort of plan your life around a little bit?
I definitely was the first 3 weeks. This last week, I think I've kind of built my endurance back up. So this last week hasn't been as bad. The biggest thing, which I was kind of surprised about, was lower back pain that I was having. And it turned out it was just swelling between. So I have the incisions that wrap around my waist. And they don't connect in the back, but they do wrap around in the between those, in my lower back and sacrum area. I had some just, normal swelling of the tissue. And that was surprisingly the worst part of the pain, actually, which is weird because they didn't even do surgery there. That part wasn't even touched, but that was where I had the most like tender pinpoint kind of pain.
Oh, now did you have any like lymphatic drainage or massage or anything like that after?
I didn't. I didn't really feel like I needed it, so I didn't utilize that. But I know a lot of women do, and if you're having a lot of fluid production, then moving that around is helpful. But I didn't have a lot of that, so I was kind of lucky.
Oh, yeah, that's nice. That's nice. So all in all, your recovery, I think, went pretty smoothly.
Oh, wow. It was better than I could have imagined, for sure. I thought I was going to be down and out for at least a month.
Yeah. So let's say if you were going to do 3 things that any mommy makeover, if they've had their surgery, like 3 things you have to have on hand.
So 3 things you have to have on hand is probably a nice big jug of water that you can fill up because you're not going to want to get up to get more water. In the first week or so, you're just not going to want to do that. Lots of pillows. I would definitely suggest lots of pillows, especially if you don't happen to have an adjustable base bed. You're going to need those pillows to prop you up. And my 3rd thing would be somebody to help. I mean, that was huge. Having the aftercare the first night was amazing. And then my husband taking off several days after my surgery just to be there to help was huge.
Yeah, that's really important that you have, especially that first couple of days before, just to get up to go to the bathroom is like an endeavor.
Taking a shower took everything I had in me. I took a long nap just after showering.
Like, okay. And then, putting in, if they have any garments and, trying to get everything hooked back on. And
I had my daughter, my 18-year-old, I had her coming in to help me after my shower to put all my garments back on. And it's not even that difficult, but it was I was just so exhausted after the shower. I was like, okay, I can't do anymore. You're going to have to do the rest of it.
Have your little post-op squad, have them ready. Well, that's so nice of you to talk with us, Nicole, and share your experience. And, we'll put in the show notes some of the links of things we talked about earlier. And just so the audience knows, and this isn't something, we talked about at the beginning, how a mommy makeover can be different things. Sometimes it involves the breasts in some way, shape, or form, a lift or an augmentation, or sometimes it involves the tummy in some way, shape, or form, maybe some liposuction. And even with Dr. Brahme, he has a specialty, and so does Dr. Breister in, labiaplasty, other things that might have gotten a little messed up during surgery or during childbirth. He does vaginoplasties. And so for sometimes a mommy makeover can be things that you might not know that people do, and they do it pretty often. So that's something that I think we did do a podcast on the lady bits and Dr. Brahme, talked about that. And I think that's becoming more common for women to say, you know what, if you need a little restoration downstairs, that's where, it can happen. And so, all of those things could be part of a mommy makeover. And so it's a little bit, I guess, like you said at the beginning, it's very individualized to what your specific, needs are.
Mm-hmm. Absolutely. And, like I said, having those consultations just with different doctors to figure out not only who you meld well with, but just kind of different opinions too on the different surgeries that could help your body. That's important too, because you want somebody who's also going to see what you see and maybe even give you some insight that you didn't even think about.
Yeah, that's a good point. Well, thanks again, Nicole.
Yeah, of course.
We'll let you get back to work.
Yeah. Okay.
Run on downstairs. And thank you again for joining.
Yeah. Thanks for having me.
Take a screenshot of this podcast episode with your phone and show it at your consultation or appointment, or mention the promo code podcast to receive $25 off any service or product of $50 or more at La+Jolla+Cosmetic. La+Jolla+Cosmetic is located just off the I-5 San Diego freeway in the Zymed building on the Scripps Memorial Hospital campus. To learn more, go to ljcsc.com or follow the team on Instagram at ljcsc. The La+Jolla+Cosmetic podcast is a production of The Axis, TheAxis.io.